The biggest mistake I see GP trainees make is not learning from their mistakes. Just last week, a GP trainee reached out and he was so confident about passing SCA. When he got his results, he was shell shocked how low he scored. Turned out he was told that he was going to be fine, but he didn't know his blind spot. You see, without constructive feedback, you might be working hard, but you're working on the wrong things and you don't even know that you're making mistakes. In this video, I'm going to show you how I help a GP trainee identify his blind spot.
From Lisa's perspective, she definitely really appreciated the fact that you asked her how the hot flushes were affecting her life, and it was a moment where a moment of rapport that was really nice for her, like to be able to talk about the fact that she's a teacher and it's affecting her work, and it felt really natural the way that you kind of went from how is it affecting your sleep to how is it affecting your work, and that must be quite difficult for you. And that kind of opened up, as a patient she felt very safe, very listened to, and ultimately she received the aim that she wanted, which was the HRT, and she felt pretty well informed as well, I think, and you flagged up sort of sensitive questions and things which I think would be very nice for a patient. So it wasn't like, things that were sensitive that were just sort of thrown in at the deep end. So yeah, that would be my input. Well done, thank you.
Thank you, Rachel. So I think it did appear that you were a little bit anxious in the consultation, and that there were pauses, and also the fact that you are trying to think what you're going to do next. So I think it looks to me that maybe you haven't practiced enough this type of case where you're having to discuss HLT. So you want to show that you've done it so many times, and the only way you'll get there is by practicing and refining it, right? There are good things that you've done in this consultation that Rachel has pointed out. Also, I think in the beginning, it's good that you got the patient's ideas in why she wanted to have the HRT. I don't think it's a good idea though to start a question by why, because when you're asking a patient question by why, they become defensive. So it's
Okay.
probably best to say, uh, what was the reason instead of why?
Okay.
Okay. Um, and then with regard to the data gathering, for HRT case, there's quite a lot to cover, and you went through various things to see whether it's suitable for her, whether she got any risk factors. I think one of the things I would also do here is to check whether the hot flushes could be caused by another pathology, rather than assuming that it's menopause. Okay, so sometimes with thyroid problems, you need to show that you're thinking about various differentials,
Okay.
right? So you could ask one or two questions just to show that you're thinking about other things as well. Could ask about any weight loss. Could ask whether she's been having any other problem with thyroid problems. Does that make sense?
Yes, makes sense. Yes.
So then with the clinical management, I think the way that you discuss the risk could have been done better. So, management of risk here. With the breast cancer, it's important that we let the patient know. I think it's best if you can emphasize that it's a very small risk. All
Small
right.
risk.
Otherwise, it sounds like it's a big risk of breast cancer when they started. One thing that could have explored here would be whether there is any vaginal dryness, because then you could also offer the a topical treatment as well. Okay. Um, this is a case where typically you would ask the patient to actually have a follow-up as well to see how things are, and then possibly put it on the repeat afterwards. So there is things that they could do as well. For example, wear a light-fitting clothes, and also there's also aspect about how they could manage with these hot flushes. Some people, they may have a fan by the bedside, so depending on what's practical for them. So overall, yeah, it's quite a complex case because there's quite a lot to cover. But once you've done it a few times, I think it'll come more smooth. Have you got
Sure.
any questions?
No, that's fine. I felt like the data gathering, I had a lot of pauses. My brain was in having the free flow of questions, then I think, okay, I should have asked this cervical screening, and like all the other symptoms just comes in my mind now. Yeah.
Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. Do you remember what time was it when you delivered the results about the ECG, Mustafa?
No, because I couldn't even see the timer on here.
So it was past 5 minutes.
Okay.
And it was quite late in the consultation. And you see how many questions the patient has afterwards. So it's very important that you try and get the results out sooner, readdress the eyes early on, because the patient is worried about the heart attack. And if you don't readdress that early on, then you're actually going to struggle to have a shared management because you're not on the same page as your patient. Okay. And then there's quite a lot here, as in what could be the triggers. It looks like in the priming, you already need to be thinking, okay, he drinks alcohol, he's got possible new AF, so I need to find out what could be the triggers here. Okay, and then it's good that you utilize information that you're given and actually make sure that there's nothing else going on like thyroid. I think with this example of a case where there has been a previous consultation done before, I would probably not actually spend too long going backward. I'd rather go forward. So checking how we're going to manage things. And then with respect to the management plan, I don't think the explanation was clear enough for the patient to understand what's the reason we're getting him on the drug. So it's important to discuss the risk, yeah, and the benefits. So when you describe what medication you're going to start the patient on, explain that when your heart is beating irregularly, there is a chance that you could develop a small clot that could travel up to the brain. And that's why it's important that we consider medication to reduce that risk. And this is medication that some people are called blood thinners. Maybe you've heard of it. So then the patient will understand the benefits. And when the patient understand it, it's more likely that they'll be open to have it, right? With regard to the exercise, I think it's important that a patient have an echo first before resuming exercise because it could be having other problems as well.
I felt that Mustafa explained it very clearly, particularly the second time, and that he put my worries to rest. I was a bit confused on the first before you interjected about why I needed to check the valves as well. I didn't understand that, as well as, well, is it a heart problem? Is it an anatomical problem, or is it a chemical, whatever? So I got a bit confused at that. But overall, he did allay my fears and kept saying it's not a heart attack, which was my biggest concern because of my dad dying from that. And I was convinced that I should start taking this medication. So that felt good for me. Great.
Thank you very much, Lloyd. So one thing here that I'd like to point out, if you're going to start a patient on anticoagulant, it's very important that you verbalize which one, because it's good for the patient to know the name, and also the examiner needs to know. Otherwise, they can't really score you marks for how you're prescribing. One thing that the patient kind of help you here was, what is there any changes if I'm not well? Or, so one thing you need to make sure you tell them is, if you do have any fall, hit your head, it's very important that you seek medical advice, or if you're having any bleeding, because there's a risk that bleeding with these anticoagulants. So you have to make sure you manage this risk. But otherwise, I think, yeah, the second time you did it, the shared understanding was there and the shared management was there. All right. Have you got any questions, Mustafa?
Yeah, sorry, just in general for everyone. Drug, we just need names overall. Say it was a case of shingles and you're gonna, it's quite active and very painful. Do you just say, I'm gonna give you amitriptyline and acyclovir, take this, 5 times or do you have to go 800 milligrams? How far do you go in doses?
So You don't have to specify the dose if you don't know it, but if you know the dose, it's actually good to say you take it like 1 tablet twice a day to the patients, something like that. But yeah, you don't need to know the specific dose. If you don't know it, that's not a problem. I got a good question from Amoj. So yes, if the patient is symptomatic and the heart rate is between 60 and 100, you would consider the rate control here. All right, it's going to help to slow the heart rate, and it's going to help with alleviating the symptom. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.